And something interesting about me is that I am the chief clinical officer of a company called Pearl. Pearl is an artificial intelligence company. And to give you an idea of some of the things that we do, we analyze digital radiographs with the eyes of an expert. So we can take an entire body of radiographs from single practice or 100 practices from a DSO and analyze what's happening in that. And why that's important is because we can get really strong data-driven insights. I know Jerem loves data too, and get really strong data-driven insights on what's happening in a practice. And so AI is not my focus today, but it comes into play when we talk about reducing stress in a practice. So, many of you are dentists that are watching this, and I would say, first of all, congrats, because you have one of the best jobs in America. And that's not just my opinion. That's what US News and World Report actually says. So for many years, we've always been number one. I mean, dentistry, number one at the top of the best jobs in America. In 2020, we dropped down to number two. Dentist was number two, software developer was number one. So I have to talk to all of our software developers and tell them they've got a better job than I do now at Pearl. But when you look in the top 10, you have 3 dental jobs: dentist, orthodontist, or maxillofacial surgeon. In 2017, we were number one. So pretty cool. I remember when the dean of, I used to teach at USC for 9 years, and when the dean of USC posted this on Facebook, I reposted it, as kind of like, look at how cool this is, look at how cool my profession is, as like a show off. And, looking at our profession, we make pretty good money, right? Just the average earner is 151,000, which is, way above what the average earner in the United States makes. The average dentist makes much, much more. We don't have a lot of unemployment when you're not in COVID, let's say. But what I started seeing was that it was saying the stress was average. And I noticed that my stress was through the roof. And also my dad, my brother, I come from a dentist family, my colleagues that I talked to, all of them had so many problems with stress, but a lot of the forward-facing statistics were saying that we have this great job. We have one of the best jobs in America. And you even look here, it's saying low stress. I mean, I don't know many dentists that have low stress. And I wasn't one of those for sure. So let me tell you a little story about my friend's dad. So you can see my friend, we call him Mello, on the left. I did my residency in Brazil. And that's his dad right next to him. And that's Jose. He is one of the top implant surgeons in Brazil, university professor. He's placed 5,000 implants. He's a millionaire, does complicated cases. He has celebrity clients that fly in from all over the world to see him. And you look at some of his cases. So this case was done in the late 90s. Extraction, immediate placement, custom zirconia abutment. I mean, custom zirconia abutment was not happening in the late 90s. Super forward thinking. And you can see just does beautiful work. And this is from the 90s. Really a leader in his field. And when I talked to Mello about his dad, what he told me is his dad's a workaholic. He really doesn't have friends. He has no hobbies besides dentistry. He couldn't relax. They would go on vacation, and 2 days into vacation, he would come back because he just wanted to go do dentistry again. He had a lot of stress with his clinics, and he was dealing with complications because he was doing these complicated cases. He also had a family history of depression. And so Father's Day 2013, Jose actually killed himself in the building that he owned. A millionaire, a well-respected dentist. And The unfortunate thing is that this is not a story that is, uncommon in our profession. Most dentists know another dentist that has committed suicide. And unfortunately, these are some of the faces of just some of the dentists that I found out committed suicide during COVID, just in the last year. And they're not just Americans. People think this is an American problem. Some are from Russia, some are from Canada, some from Europe, some from Australia, some from South America. So this is, unfortunately, one of the other things that we're well known for. So we have one of the best jobs in America, but guess what? We also have one of the highest suicide rates. So this study shows that being a dentist increased your risk of suicide by 564% by being a dentist. And this is, I think, some really scary statistics. So a male dentist is 8 times more likely to commit suicide. Female dentists, 5 times more likely. Male and female dentists combined, 7 times more likely. And the national average, this is not 7 times more likely, this is 7%. The national average is less than 0.5%. So when you look at this, we're 17 times more likely to commit suicide. This is an epidemic in our profession that unfortunately we've swept under the rug for many years because it's such a taboo subject and nobody wants to talk about that. Well, I wanted to take it upon myself to bring this up because I went through a difficult time in my life. And some people say that suicide is underreported by 33%. So these numbers could be even higher because of the shame and the guilt that comes from the families of the deceased dentists. What we look at is, when is this happening? It's earlier in life, usually. In the middle of life is when we kind of figure out in our practices, how to deal with staff, how to deal with complications, how to grow our practice. We're maybe more successful at this time. And then unfortunately, suicide rates go up towards the end of practice when people are aligning their profession with their purpose in life. And then if their profession goes away, meaning that they retire or they get hurt or they can't work, the suicides again, unfortunately. So why are we killing ourselves? Let's go into some of the top stressors in dentistry. Well, number one, an environment of fear. We work every day in an environment of fear. 36% of patients have dental anxiety. 12% of patients have extreme dental fear. And these patients, these are the ones that come into your practice. First of all, they cancel twice before they come in because they can't convince themselves to come in. They're sweating, they're white knuckling. This is an extreme dental fear. And for anybody to think that it's easy to repeatedly treat people that are in an extreme fear, they've got to be joking, because every day this weighs on you. Going through this and injecting a patient that has an extreme fear. And this fear, this dental fear and anxiety, is complex. It's multifactorial. It can happen exogenous. It can be an endogenous thing. Previous experiences, for example. Every patient says that there's been a dentist that put their knee on their chest. I know that's absolutely never happened in the history of dentistry, but somehow everyone thinks that this is happening. So these patients come in with this extreme fear. And you may be thinking like, well, it's not maybe that bad, right? So some studies show that the number one fear in the world is public speaking. Yay, I beat that one. Number 2 is the dentist. And number 3, in certain studies, shows death, meaning that people would rather die than come to see us. So dealing with this fear and anxiety is difficult because these patients come in, they're afraid of dentistry. So maybe they don't come in and they avoid dental care. And then what happens? They have deterioration of their oral cavity. Then they need even more extensive, expensive treatment. And on top of that, they have the fear and the shame of not taking care of themselves. And to think that that doesn't affect us. So there's some studies that show that having empathy leads to cortisol stress hormone, meaning that like when we're injecting a patient, there's studies that show that our blood pressure actually goes up 20 points sometimes. So imagine we have high blood pressure the whole day because we're trying to take the pain and the fear out of our patients. So that leads us at risk for atherosclerosis, vessel rupture. In addition, because our adrenals are constantly firing, our cortisol levels are high, we become edgy and moody to our staff, to our family, to our colleagues, because we're trying to deal with patients constantly that are afraid of us. Number two, the media portrayal. Well, we know that we don't have good PR in dentistry, right? I mean, remember the guy that killed the lion? Everyone focused so much on the fact that he was a dentist. It was like, oh, well, of course he killed this majestic creature. He is a dentist, and dentists are all sadists and masochists. Every image of us in the media, we're trying to rip people off, hurt them, screw them over. And it's almost like we get enjoyment out of this. And this leads into, I think, why patients come in having this fear of us. Our offices are always perceived as just horrific places to be. And most people don't want to come in and see us. You know, I have these experiences, and I think every dentist in the world has had this, where I say, you know, I meet someone, I say, oh, I'm a dentist. And they go, oh, I hate dentists. I'm like, remember when I just told you 5 seconds ago that I was a dentist? People feel so comfortable telling dentists that they hate them, having never met them. We wouldn't say that to a teacher or a construction worker or, you know, a gardener or another professional. But in dentistry, everyone leads with their fear. And, you know, I sit down and I see a new patient maybe and say, good morning, Mrs. Jones, how are you doing today? And she's like, well, I'm fine until I came here. I'm like, well, it's great to see you too, Mrs. Jones. And, you know, my first few years out of school, I kind of laughed this off. After a decade of hearing this, it kind of got old and it starts to weigh on me. People telling me that they hate me constantly when I'm trying to help them. I'm trying to do my best. Number three, physical and emotional stress. This was probably one of the biggest for me and many of the biggest for many of the people that I've been able to help now. So let's look. This came out in 2020. Jobs that put your overall health at risk. Well, we've got a dental hygienist, general dentist, laboratory technician, dental assistant, and prosthodontist. Of the top 7, 5 out of 7 were dentists, were dental related, basically, which is crazy. Let's look at some of the statistics again. More than 87 to 90% of practicing dentists experience musculoskeletal pain. I'm one of them. I have chronic back pain. Low back pain, chronic back pain is a good amount of them. 70% of dental students by the 3rd year are already experiencing pain, whether it's headache, you know, their shoulder, wrist, neck. So we come into this profession with pain. Now, we don't work in a sterile, bloodless, ergonomic office, right? I always say we work through a Cheerio. and we're dealing with the tongue and the cheek and the upper jaw and the lower jaw, and we're trying to do a DO filling on number 18. I mean, it's physically a difficult job, even in relation to other specialties of medicine. So in this study in 2015 by the Journal of American Dental Association, 83% of dentists perceive dentistry as being very stressful. The biggest causes were running behind, pain, heavy workload, late and anxious patients. Yeah, I would agree with that. So emotional stress. We talked about physical. Let's talk about emotional stress. I love this little meme I saw on the internet. It says, "Relax, David. It's just a small surgery. Don't panic." And the patient goes, "Well, my name's not David." And the doc goes, "Oh, I know. I'm David. I'm just trying to get myself ready for this procedure." And I found myself at times like this. So again, I'm a researcher. Let's go to the studies. 11% of dentists have depression. Only 6% of the general population has depression. 6% of dentists have anxiety disorder. Only 3% of the general population have anxiety disorder. 4% of dentists have panic disorder. Only 2% of the general population has panic disorder. So when you're talking about depression, anxiety, and panic disorder, we're twice as likely to suffer from all of these on a daily basis. And more studies, 3,500 dentists surveyed, 38% said they were always worried. 34% said they're physically or emotionally exhausted. I definitely feel and felt that way. You're juggling your patients, your staff, your partners, your insurance, your family, your health. We're constantly juggling and trying to still do our best, deal with these difficult patients, deal with these difficult cases, manage our finances, manage the software in our practices. And it's draining. So you hear about this topic of burnout, and I heard that a lot of dentists had burnout. So I looked up what the definition was, and it said a syndrome of emotional exhaustion, depersonalization, and reduced personal accomplishment. Okay, that's kind of what I thought burnout was. Going deeper, it said it is a response to the chronic emotional strain of dealing extensively with other human beings when they're troubled or having problems. I mean, that is like the definition of dentistry. Every day, we're dealing with human beings that are troubled or having problems. That's exactly what our profession is. So there's no wonder why burnout is such a big topic, and it's so amazingly high in our profession. And burnout, unfortunately, in the research, ultimately leads to depression. A long exposure of burnout generally leads to depression. And with dentistry, we oftentimes come in with this anal retentive, kind of controlling personality type. And if we don't come in with it, then we teach our students this in dental school. So I've come up with this idea of the dental path to depression. And it's so unfortunate that it's so common in our profession. We come in with a personality that is high achieving. You know, most of us are overachievers. We like to control things. We go to dental school and that gets really ingrained into us. That leads to our job stress, which then leads to the burnout we just talked about, which ultimately leads to depression. So there's no wonder that so many of our colleagues are suffering in silence over this. It's almost built in to our profession. And I've got a few more topics and then we'll talk about how to get better. So revisions. Revisions was one of the biggest ones for me. And you may be thinking, well, what the hell is a revision, right? Because we don't use this terminology in dentistry. I got this from my medical colleagues. These are some of my cases that, you know, have failed, have had problems, have had complications, patients that have threatened to sue me. It happens to everybody. if you practice long enough. So I do a lot of implant cases, higher risk cases. We have to understand that mistakes happen. We're human. We're not an AI, right? AI is very consistent. Humans are not. Biology happens. We're dealing with things that sometimes we can't control. And medicine and dentistry is so different in the sense that if I got in a car accident and I hurt my knee and I had to get surgery, let's say, the surgeon does their best, but I still limp afterwards. I'm not going to say, oh, well, the surgeon did it wrong, so I'm going to sue the surgeon. And if I have to get a revision surgery, the surgeon has to pay for it themselves. I'm not paying for it. However, in dentistry, that's exactly what happens, right? So let's say we do a crown and, let's say it doesn't limp. Let's say the aesthetics limp, or they have some sensitivity that limps, right? What do the patients do? They say, well, doctor, you have to redo it. It's your crown, the crown that you did. You have to redo it. And not only that, but I'm not paying for it. You're paying for it. And we're so worried about litigation that we usually do it, right? Because we're worried about the litigation. And that has led me to this idea of the triangle of blame. So I used to think there were two people to blame if something happened, right? So if I did a surgery, let's say, I do a lot of implant surgeries. If something happened, either I did something wrong, like, my technique wasn't right, I didn't follow up right, didn't use the right sutures, didn't use the right bone, right implants, or the patient did something wrong. So they sucked through a straw or they ate something hard. That's how I used to think. Then I had this epiphany where I realized there's all these other factors that we can't control, right? You have the biology of the patient, their genetics, the musculature, how their tongue moves, the width of their jaw, all of these other factors that we can't control. And so we need to talk to our patients and make them understand that not only are we human and we can make mistakes, they're human, they can make mistakes. And then we have this third factor that none of us can control. And so complications happen. If you practice long enough, if you do enough cases, failures happen. And we need to be upfront with our patients. Not everything we do is perfect. We're going to try our best. They can try their best, but revisions still happen. We need to stop pursuing perfection. As dentists, we are perfectionists. And, I was giving this lecture and a dentist raised his hand. He said, a perfect restoration can become damaged by the patient's neglect, despite the efforts of the dentist. And I think that is so true and unfortunate. Right? So in the US, when we start dental school, we do this white coat ceremony. And the white coat ceremony is meant to get people ready for practice, get them started in their dental career. And I went through this, but I don't remember all these topics. And when I went and looked back on it, it's actually a great summary. So it says, patient care is the point of practice. Fantastic. The doctor-patient relationship is essential. I tell you, I've had some bad doctor-patient relationships. Like I said before, patients that threatened to sue me, patients that I wanted to dismiss, that I did dismiss. It definitely needs to be essential. Discuss options and possibilities. Fantastic. I was not doing this early in my career. I was not going forward and telling the patient what could happen. It could fail. And guess what? If it fails, you have to pay for it again. Because unless it's my fault, and I'll admit if it's my fault, I'm not going to pay and take my overhead, take my staff time and my materials to do it again because your biology or your physics didn't accept what I do and worked for 90 other patients. Mistakes will be made. I wish I focused on this before I went to dental school. Mistakes will be made. We need to understand this and accept that we are human. Tell the truth, be assertive, and consult with your patients. And what's crazy is number 7 here, manage your stress and your life. I don't remember them talking about this in dental school at all. I would love if a topic like mine could be a requirement in dental school to take this. And not only that, but would be a requirement for every 2 years we have to do CE. Because what I realized in my career was I was trained by the best people. I mean, Pascal Magnier taught me how to do veneers. Sasha Jovanovic taught me how to do dental implants. Christian Coachman taught me how to do smile design. And guess what? I wasn't managing my stress in my life. So it didn't matter how good I was clinically. What mattered was I wasn't controlling the stress in my life. We need to focus on this in our profession and stop sweeping it under the rug, because it's such a taboo subject to talk about. Number 5, litigation. Oh man, if you have received a certified letter from a patient, that is a bad day. That's starting the worst year of your life, I'll tell you that. 5% of all malpractice trials involve dentists. The median price tag is $53,000. That is not including your legal defense. So that usually goes up a few $100,000. I don't know about you, but I don't have a few $100,000 to throw around to defend myself, oftentimes in a case where I did nothing wrong. That's the unfortunate problem, is we can be sued even if we did absolutely nothing wrong, simply because we have a bad doctor-patient relationship. And I've seen it with many of my colleagues. 72% of dentists are actively fearful of being sued. So what this means is that we're treatment planning in a way that avoids litigation, which may not be the best way to treatment plan for the patient. Ideally, we should be able to treatment plan what is best for the patient, right? But we may not do that treatment because it may be too risky and you don't want to be sued. And there's so much media coverage of clinical negligence. Anytime the terrible accident happens where a patient dies in a dental chair, guess what? It's on national news. I mean, people die in hospitals all the time, every day. But if 2 people die in a dental chair, it's all over the place, and the dentist is immediately blamed. And oftentimes I don't know what happens in these situations, but because it's perceived as being so safe, it has to go on national news, and it's just so unfortunate that that happens. We have a high workload and high patient expectation. So dental economics says 9 out of 10 dentists should expect to be sued by a patient or employee. I've gone through both patient and employee in my first 10 years of practice. 42% of dentists have received a claim for clinical negligence during their career. And if anybody's gone through this, it affects your morale. You feel like, I thought I was good. I thought I knew what I was doing. What have I been doing the last 15 years of my life? Your confidence, your health. I was physically stressed. I couldn't eat. I had diarrhea. I couldn't be with my family. I was so focused on this litigation. And the last aspect is lack of sympathy. So what I realized when I was going through my dark time was I would talk to friends that are non-dentists, let's say. I would talk to friends and, let's say one of my friends works at a video game company. He's an engineer. And I'd be like, I'm having these hard times with patients. I'm having complications. I still have $400,000 in student loans, plus my practice loan. I'm just really stressed out. And my friends would say, Kyle, what do you have to be worried about? You make, hundreds of thousands of dollars a year. You're a dentist, you're a doctor. You're well respected in your community. You have a great family. What do you have to be worried about? And they just didn't get it. And so what I realized was that there's this this thing of being in the trenches. You know, I wasn't in the military. I will never know what it's like to be in the trenches of combat with someone shooting at you. But it's just like how a software engineer will never understand what it's like to be in the trenches of dentistry. When you're trying to get that margin, but it's bleeding and the patient's in pain, and your staff is coming telling you that you have a hygiene check to do in the next room, and you just got a letter from a patient that's threatening to sue you. Only dentists understand this. And I found out that when I started speaking about this and talking with other dentists, I got sympathy. And this is hard. This is like the golden handcuffs, is what one of my friends calls it. We make good money. We're well respected, right? We've put 15 years of school into this, and then we have all this stress. So what is really the answer? How do we get out of this? How do we get better? Well, I had to go through my own journey. So what I started to do is write down during my journey what I was doing and how I could get better. And for me, being a researcher, I went directly to the research. So what do most dentists do about stress? Well, 24% do nothing. 32% say, well, I exercise, so that helps my stress a little bit. And 13% say, I just cope with it, I deal with it, which maybe isn't the right thing to do. You know, only 10% of dentists take any time off. I mean, that is a crazy statistic. Only 6% have a hobby. Most of us, dentistry is our hobby. We come home, we read articles. We come home, we look on Instagram and look at other dental stuff. We're obsessed with dentistry. We love it. And I'm one of those people. I love our profession. What I found was that support groups offer a simple and powerful mean to ease the burdens of medical practice and prevent delusionment and subsequent impairment among healthcare workers. So what I did is I started a group called Lightside. And Lightside is an online CE course, and it's also a club that allows dentists to get out of the dark side of dentistry, where I was, and come to the light side of dentistry, where I am now. And what we do with Lightside is we break it up into 5 modules. We realize there's a problem. We go through and identify all the problems. We figure out what our real purpose in life is. We learn techniques on how to go forward with that purpose while keeping dentistry in its place. And then we thrive with all of the ways that we learned how to manage our patients, how to manage our practice, how to manage our health. And I can't tell you how gratifying it's been. It's been one of the most proud moments of my career. You know, I've spoken on, you know, at the AO and the AACD and Seattle Study Club, and I've been on the top lecture circuit in the world. I have a successful practice. None of that has been more fulfilling to me than talking with other dentists who have been stressed, who have been suicidal, who have wanted to quit, who are going through divorce because of their stress in their practice, who are going through litigation. And being able to listen and be there for them has been so fulfilling for me. So real quickly, you know, some of the things we talk about in my Lightside course, how do we get better? We talk about doing predictable dentistry. We talk about doing things like guided surgery, doing smile design, using rubber dam, understanding how to do immediate dentin sealing to reduce sensitivity, to reduce your bonding errors. I'm lucky that I had some great mentors that allowed me to do predictable dentistry. Because if we can prevent stress, that's the best way to do it. We talk about complications. We talk about how to talk with patients about fees, doing treatment agreements, which is different than a consent form, dismissing patients I loved this one. I saw someone speak and they said, 90% of your problems come from 10% of your patients. So just dismiss those patients. And I was like, well, I can't dismiss patients. What do you mean? We want more and more and more and more patients. But guess what? When it's a patient that stresses your staff out because they never want to pay, because they're always late, they never want to take x-rays, they never want to do an exam, they never recommend anybody to come to your practice. We run private practices. Guess what? At my practice, we just started getting rid of them. Bye, 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 bye. And you know what? The stress went down in our practice. It really was a great thing. How do we get better with our health? So in the course, we go over what I call DERMs: diet, exercise, relationships, using meditation, and also understanding sleep. Sleep is so important for us dentists, especially because we're one of the only professions that can make people sleep better. We can move the anatomy and put the anatomy in the correct place, maybe besides an ENT, that can make people have better airways. You know, I think the future of dentistry is two things: AI, which my company Pearl does, and two is sleep and airway. Those are the futures of dentistry, in my humble opinion. So what's really the answer? What can we take away from today? Well, we know that there is this taboo subject of depression and anxiety in our culture. We need a public awareness and acceptance of this, especially in our profession. We need positive media associations with dentistry. I've been trying to work with the ADA on this. We need litigation reform, debt reform. We have many doctors that come out of school $500,000 in debt. Very difficult to have this cloud over your head for your entire career. We need to let technology do the work for us. You know, you have companies like Dental Intel, you have my company like Pearl, you have guided surgery, you have CT scans, you have intraoral scans. Utilizing technology can help you be more productive, more efficient, more repeatable, more consistent. You know, as humans, we're not consistent, but technology is. We need to not overwork or over leverage ourselves. We need to work in groups to support each other and know that we're not alone. We're not working in silos like many dentists did in the past. We need to understand DERMs: diet, exercise, relationships, meditation, and sleep. And last, and probably one of the most important things for me and many of the Lightsiders that are in my club, finding your purpose. Because what I thought was my purpose in life was to be a dentist. I wanted to do the best dentistry ever. When I died, I wanted people to say, gosh, that Kyle Stanley, he was the best dentist in the world. And that's great to have passion about your profession. The problem is we can't align our purpose in life with our profession, because guess what? Our profession is one that we always have failures. Everything eventually fails. So if you align your purpose with your profession, and your profession will always have failures, your self-worth drops when you have those complications. Because you don't just have guilt about those failures, you have shame. And the difference with guilt and shame is that guilt means I did something wrong, but shame means something's wrong with me. And that was what I had. I had to realize that I'm more than a dentist. I love dentistry. I'm passionate about it. But guess what? My purpose in life is my family. My purpose in life is to help others. I want to be known for someone who can light people up. If I die, I kind of don't want anyone to say, oh, Kyle did great dentistry. Wow, he did cool guided surgery. No, I want to be known as Kyle really helped people. He really cared for his family. That's what my purpose in life is. So I had to put my profession in its place and say, I love dentistry. I'm passionate about dentistry, but dentistry is how I make money. Dentistry is not who I am. And that was a big change for me. So there's this great quote by Bill Gates when COVID first happened, and he said, "It's reminding us that our true work is not our job. That is what we do, not what we were created to do. Our true work is to look after each other, to protect each other, and be of benefit to one another." And I love that he says that. If you're interested in learning more about AI and about what Pearl does, you can contact us at contact@hellopearl.com, or you can contact me directly. If you're interested in what I do with Lightside or any of my courses on mental health, find me on Instagram, just Dr. Kyle Stanley, or my website, drkylestanley.com, or you can email me or my speaking coordinator at info@drkylestanley.com. So it's been a pleasure being amongst all you great colleagues, and I'm happy that Dental Intelligence is a forward-thinking company that even allows a topic like this to be on their webinar today. So thanks so much.
Oh, Kyle, man, you're awesome. And of course, I think that this is a topic, just generally speaking, that is under talked about, right? That people aren't alone, and that there is a way, and that there is light at the end of that dark tunnel. So awesome. Gosh, there's a lot of, I'm pulling questions from a lot of different areas. If you wouldn't mind, I think that we could probably spend the next couple minutes on your slide of the 5 steps that you focus on. And if you wouldn't mind just expounding a little bit on that. And then on top of that, there were a couple questions that came in from a lot of the talk, a lot of the statistics we hear have to do with dentists. Maybe shed some light just on dental professionals, maybe hygienists that are experiencing some of those emotions or problems.
Right. Yeah. So the first question is we call the success path, how we get there, right? So for me, we start with realizing that there's a problem, right? It's the same with, like, if you're, I don't know, going through a 12-step program or something, you have to realize you have a problem. And I think that was first for me. I had to come to my valley of despair and realize something has changed for me. I'm not as happy. I'm stressful. I'm losing weight. I'm not eating. Something is wrong for me here. So I had to realize it was a problem. Then I had to go through and identify everything. So I went through every aspect. So we talked about, a few of them today. Talk about litigation and patient fear and, suicide and mental stress and all of this. I had to go through every single one. And that's what we do in our course too, is we go through, I just had a meeting with my Lightside Club today, right before this, and we talked about scheduling, how crazy scheduling can be and how it can impact your stress so much, and how simple changes in scheduling can help. So again, realizing, then identifying. In the identify module, we go through every single thing. I mean, even in our last course, one of the big topics that I didn't have in, that some of our members recommended, was gender differences. So we had a lot of female doctors that said, I have guilt about working because I know I really want a family. And, I'm having reproductive issues because, I am older, because I spent 10 years in school and now I'm freezing my eggs. And so we're actually going to be releasing a new module on that. After our identify module, we go to purpose. And purpose is one of the most important modules. Like I said, that was the biggest change for me, was realizing that I'm not Kyle the dentist. I'm Kyle the father, Kyle the husband, whose profession is dentistry. So that was like such a big mindset change for me. Then we go into our learn module. Learn module is a lot about health, daily habits, things that we can do to avoid stress. And then again, in our thrive module, which is our last module, we go more into the dental aspect of avoiding stress. So like I said, clinically looking at how to avoid stress clinically, right? With rubber dams, proper bonding technique, guided surgery, whatever it is, but also how to talk to patients. And we do things like, scripts, talking to patients before the complication happens, and then talking to patients after the complication happens. So those are the 5 steps in the success path of Lightside. So we have realize, identify, purpose, learn, and thrive. Now, going towards your second question, which was about dental professionals in general, there isn't as much research on it, which is why I don't focus on it. Most of it is done on dentists. However, we've had people part of our community that are lab technicians, that are hygienists, dental assistants, front office staff. They all have their own unique stressors, and many of them are the same, but many of them are different. Many of the stressors of the dentist are those other people, right? And the same thing. Many of the hygienists, the stress for them is the dentist, or is the front office manager, or is the lab technician, or whoever it is. And that's why we like to be so specific, because when I started talking about this topic, I had some friends that were doctors, and they would say like, oh, can I join? And I would say, you can join. However, your specific problems are totally different than dental problems. We may have, 40% that is the same, but you're not going to know what it's like to do a DO filling on a patient with a giant tongue that you can't get numb. It's not going to relate to you. So it's definitely there in every aspect of dentistry. But, with my experience with being a dentist and an owner, that was where I tried to go with it.
I feel like I could just talk to you for the next hour. I personally have all these these questions and thoughts. So awesome. Couple other questions. So you talked a lot about getting to the root of it, which I love, right? Like a lot of times we hear lectures like this, and there is some surface level things that we can do to calibrate ourselves and make sure that we don't fall too far off the track. I love that really you're prescribing like a deep dive into it. Like, let's get down to the core and fix a couple of the things there, so this goes away. You're not revisiting these thoughts or these ideas, or even cycling the things that you do in your life that bring that stress. You don't even realize you're the one that's bringing it, right?
Yeah.
What are some basics? And I'm trying to sum all of these questions up so I can hit a couple
Sure.
out here. What are some basic what's the word I'm looking for? Not like a protocol, but some basic things that individuals can do that kind of give them like that first check, where they're not in self-denial. It's kind of like, okay, I do have a problem and I need some help, and I need to take that first step. What would some of those
I'll tell you some of those like red flags were for
there
me.
we go. Perfect.
So the red flags to me were anytime I pulled up my phone and I saw a text or a call from my office, my heart started beating. That was a big like, okay, something is weird, because this is what I do every day. Why am I expecting that something's going to be bad? Another thing was when I would be driving into the practice, again, I started having some anxiety. And so for me, realizing when I was having anxiety, when I was sad or nervous, and having it relate to the practice, that was a big red flag for me. Another thing that I started happening, and I don't know if it was a coincidence, but I had multiple patient and staff relationship problems within a year. And this was my real valley of despair that I had to capitalize. Was, I had a patient, very big case that threatened litigation, had to give back a lot of money. I had another patient that tried to extort me for money. I then in the same year had a staff member who tried to do the same thing. So I call this my 3 events, and we talk about this in the course, like the 3 events that pushed me to realize, okay, I need to change something. And I thought it was just me. And there's things I totally did wrong. But then after talking with, hundreds of dentists around the world with my speaking career, I realized like they're going through the same thing. I would tell them the story about that patient and they would say, I just had a patient like that yesterday. Or, I had 2 last year that were like that. Or I had that staff member. And then so I realized there were some aspects of it that were my problem that I needed to change. How I talk to patients, talking about complications, different things with staff, organizations. But then there were some problems just with the profession in general that everybody was going through. Some of those you can change and some of those you can't. So we have to go through and realize which ones you can change and try to avoid, and which ones you can't, and have to realize how to deal with it or how to best handle those situations.
I keep putting
muted.
myself on mute and then I go to talk. And it's awesome, brother. Thank you so much. We've got, for those that are just joining us as we're switching over, we just got done listening to Dr. Kyle Stanley, and an individual that I just met just recently, actually, through another colleague of mine at Dental Intel, and am fascinated with where his passion lies, and that dark side of dentistry, and helping people realize that there is light and that there's hope, and that we're in control of those things, that those influences that lead us down those crazy paths.
Yeah, and Jerem, one more thing. What I realized, kind of to bring it all back to the topic of this event today, is when I got my mindset correct and when I got my mental health and my mindfulness in order, I became more successful. Patients felt a better connection to me and were more likely to do treatment. They were referring more people. It was crazy. I was talking to people more about complications, saying, this is probably going to fail. It probably won't last. And guess what? They were doing more treatment with me. So just kind of bringing that all back, being in a better mindset and having better mental health, I think you kind of radiate some weird pheromones, but I became more successful.